Dobutamine. We give dobutamine a 3 out of 5 on our scale of yield or importance for test. So it's good to know about dobutamine, but not necessarily really high yield. Okay, it's also known as Dobutrex. It's a structural analog of isoproterenol. So check this out. Look on the right side here. This is dobutamine that we see. If we break off, there you go, isoproterenol. Structural analog, very similar in shape, and thus it works on similar receptors. What does isoproterenol work on as far as receptors? Well, it is a non-selective beta agonist. It works on both the beta 1 and the beta 2. Dobutamine, because of the slight change in shape and perhaps the increase in size, it only works on the beta 1 receptors. Next up, for the mechanism of action. We've actually combined 3 slides on this slide because, again, like we said, we don't have much to say about dobutamine. Again, great for beta 1. If you need to isolate beta 1, this is your friend. The clinical use of congestive heart failure gives us a good example of why. If you just need someone's heart to put out a little bit more blood, but you don't necessarily want all the other effects, such as alpha-1 constrictions or beta-2 bronchodilation, dobutamine is probably a great choice. There are other drugs that we use for refractory congestive heart failure, but dobutamine could be used. And lastly, for the side effects. Look, anytime you stimulate the heart, you are putting the heart at increased risk for an arrhythmia, especially in elderly people. And because it's beta 1, it makes sense that it's likely going to be a tachyarrhythmia that you put them at an increased risk for getting. Knowledge challenge. You are managing a 72-year-old male congestive heart failure patient who seems to be slowly decompensating. You order dobutamine to be started via an IV infusion or a drip. However, your staff accidentally heard you say dopamine, not dobutamine, so they started a dopamine infusion. Assuming that the dosages were low and safe, what would be the difference in physiologic effect? The correct answer is C, as in Charlie. Remember, dopamine increases blood flow to the splanchnic organs. Dobutamine does not touch the dopamine receptors. Dobutamine is really only a beta 1 agonist. Now we know that there's a little bit of beta 2 in there as well, but mostly just beta 1. It's really only going to touch the heart. Okay, so that means that A, the top one, is incorrect. B, the second one, is incorrect because if anything, dobutamine has a little bit more beta 2 action than does dopamine. And D, as in delta, isn't true either because both of these drugs are not going to cause a reflex bradycardia.